or transfer assets, and that's causing state budgets to collapse. So there's no alternative in between.
Before this law, there was no long-term insurance available from the federal government.
That's correct.
I want to get your response to part of a New York Times article about private insurance. In this article, they write the industry, which lobbied energetically but unsuccessfully to strip the Class Act from the health care bill, continues to condemn it. It's actuarially unsound. Quote, this is a flawed plan that's not going to work. This is from Jesse Stone, the executive director of the American Association for Long-Term Care Insurance. How would you respond to that?
I think he's basically short-sighted and incorrect. And the actuarial soundness of it was judged by CBO to say that it's solvent, it's self-sustaining, solvent for 75 years, and there's plenty of actuarial science that says it's a good program. There are also mechanisms within the bill so that the Secretary has to, in effect, assure Congress regularly that it's sound out 20 years periodically. So we think that that is short-sighted. It's they're feeling the issue of the competitiveness of it. We don't know why. There's nothing wrong with private long-term care insurance. It's just that most people either can't afford it or would be screened out because of pre-existing conditions.
So you don't think that people will make that decision, I can get this government long-term insurance, it's going to be much less expensive, versus something from a private insurer and they go with the government plan instead, that will create a loss in the private insurance market?
I don't think so. In fact, in other countries where they have similar programs now, the supplemental insurance market, think about Medicare supplemental insurance, has been highly, highly successful. And we believe that some of these companies, in fact, we've heard that some of them are already thinking about supplemental products to help everyone.
When's this long-term insurance going to be available through the government?
Well, as soon as possible. There's a schedule provided for in the law of certain milestones that have to be reached, but we hope as early as next year or the following year, because they got to set up mechanisms to put it in place, but the sooner the better.
Here's a call from Oxnard, California. Will, on our Democrats line, go ahead.
Yes, good morning, Mr. Minnix. I believe that health care should be a function that is provided by the government from beginning of life to end of life. I think it should be taken away from private insurance companies whose whole purpose is to make money. I think that a national sales tax or a tax on vices could be used to pay for this. All the westernized industrial nations have health care for their citizens as a single payer. Most of them do. I also think that President Obama and the Congress should have given at least $100,000 to every United States citizen taxpayer as a stimulus package, instead of giving that money to insurance companies like AIG or the crooked corporations.
All right, Will, what about his comments on government-run health insurance?
Well, I would say that from a class standpoint, what you have is a classic public-private partnership. You have a way for citizens to pay into a national pool that can complement what the private market offers. My guess is the private market will come forward with a number of products to compete with this, which would be great, and they'll add to the supplemental part of it. So I think we have in class sort of an ideal approach to the long-term services and support segment.
And class stands for what?
Community Living Assistance Services and Supports.
This reportedly one of the last projects of Senator Kennedy's to get this included in the health care legislation.
That's correct.
Did you work with him or his office on this?
Yes, we did very closely. It was interesting. His motivation initially came out of the younger disabled community, building on the success of something called Cash and Counseling, which worked very well in 3 states. We were studying it from the aging standpoint because we recognized that Medicaid was becoming less and less viable. And so there had to be an alternative because of the growing demographic population. So we came at it from the aging standpoint. They came at it from the disability standpoint, and we all pooled our interest beginning about 2.5 years ago.
Well, in terms of disability, isn't it true that if I become disabled at work, that Social Security, there's Social Security money there to pay for to pay for things?
Well, what that does is basically provide you some income replacement. Mm-hmm. The issue becomes you can replace your income. If you become disabled today, you probably could have enough income to keep your house. But how do you pay for, if your wife works, how do you pay for someone to come in and help you get to the bathroom or function every day? You don't have coverage for that. And so she's either got to stay home and quit her job, or you're at home and hopefully you can survive the day.
Here's Bowling Green, Kentucky, and we say good morning to Corey. Bowling Green, Ohio. I thought
Bowling Green, Ohio.
There you go, Corey. Go ahead.
Yes. Hello, William. I gotta apologize. I'm trying to get on the air. I really don't want to talk about healthcare, but if you ever do get a chance, you should come by Bowling Green State University and talk about healthcare and whatnot.
Any excuse to come to that part of the country be great.
Okay, great. But yes, I think a lot of our problem in this country has to do with the monetary system and entering into an age of globalization. And I just wanted to, you seem like you know a lot about economics. I just wanted to ask you what you think about entering into this world of globalization and how capitalism, can it survive? Is there a need for a new system? Because
Well, Corey, we'll get a response, not really on topic, but if you feel like you want to answer, go ahead.
Well, I think that that's above my pay grade, but here's what's good about class. You have an opportunity as a private citizen to pay into a fund of your own choosing to provide for your needs if you become disabled. That is classic capitalism. It's classic self-responsibility. And it's classic sort of collective good for people that may get into trouble. And so it's a best of a lot of different worlds politically from my standpoint.
For the employer, how much extra paperwork will there be for if they want to offer this to their employees?
It's interesting. Some of Senator Kennedy's staff asked some. It's another little check off on a piece of paper. And many say that it's not a big deal. Everybody has to fill out forms. You pay something to the government. Shouldn't be a big item. For many employers, I think they're going to find that they will want to offer this and help contribute toward it as an employer of choice competitive game, because they recognize the need. It's already costing employers $2,000 per employee for lost time at work, stress-related illnesses, and so forth, of family caregiving. And most families will face these issues.
Our next call is from Kentucky, Arlington County, and Mary Jo on our Republican line. Go ahead.
Good morning, and thank you for taking my call. I would like to ask him, do we have the option of opting out of that? And why in the heck can't we put that in our own savings account and use that as a tax deduction, which we all need since you've taken all of our comp-taking money? And the last one is, how do people without the internet find out what's on the health care bill? Rural areas do not all have an internet access, and they are not. I'm a disabled person. I'm chronically disabled for life. I'm a pain patient. There ain't no help, no getting out of it, no way around it. And I personally think he should have put pre-existing conditions, period.
Mary Jo, where do you get your disability insurance from?
Through my company. My husband works.
Thanks for the call. Any thoughts to her about opting out?
Sure. Yes, you can opt out. It's your choice. That's one of the good things about it. And you can start your own savings plan. Hopefully, most Americans do, but we know that we don't tend to save. What this does is provide for a large insurance pool that if you had this insurance before you became disabled, you would be eligible today for, on average, a $75 a day benefit, according to the projections used by CBO, to help you be as independent as possible. And it pays for itself. And you collect it because you had the foresight as a citizen when you were younger to pay premiums for it. But it's your choice.
Chicago's next up. We say good morning to Dwayne on our Democrats line. Hi there.
Yes, good morning. I first of all would like to thank C-SPAN for your wonderful shows. I just have a couple comments. I keep hearing the word transparency regarding health care. It's been on C-SPAN every single day. And if you took the time out to turn on C-SPAN, you'd know everything that you need to know about health care. The second thing is I'd just like my fellow Americans to realize that we can either pay now for our fellow citizens or we can pay later, meaning that number one, preventive health care. Let's just take blood pressure, high blood pressure. If that's taken care of now, we won't have to pay later on when that individual gets kidney disease, heart disease, etc. And I just wish Americans would educate themselves regarding the things that they call about on C-SPAN. Thank you very much.
Larry Minnix.
You know, it's interesting in the long-term services arena. This is one of these topics, Bill, that most every family will face the phenomenon, and nobody wants to talk about it because it's hard to think about an elderly loved one becoming disabled, and you don't want to think about a child. This is why we're beginning to see that there are almost as many younger people with disabilities for different reasons that are going to need support, and these are very hard things for families to confront and discuss. So one of the good things about class is it's putting this topic on the national agenda, and through employers giving the option to offer it, and students having the opportunity to purchase it, then hopefully you have a national dialogue around planning. Our focus groups and some polling we did is interesting. 25 years ago, or a generation ago, the Pepper Commission suggested that these issues were insurable sets of circumstances in people's lives and lend themselves to this kind of large insurance pool, but we spent a generation not insuring for it. And I think it's largely because we wanted to deny that this kind of thing could happen to us. It's hard to face.
What's the typical age that people should start looking at long-term care insurance, and what is the typical age they really, in reality, start buying it?
Well, I think some of the private carriers could tell you, but people begin to see it in their early to mid-40s. They say, you know, my dad had heart disease, or I got dementia in the family. Maybe it's time for me to see this. This program provides for students at $5 a month to begin to insure against this. So the planning part of it, we think, is one of the geniuses of the provisions of the bill.
Richard is next up. Prairie Grove, Arkansas. Welcome.
Well, good morning, C-SPAN.
Good morning.
Can I say something before I make my point?
Sure.
Yeah. In the morning when we have to stick to the subject, would you please stick to the subject too? You throw these tidbits out at us and then tell us we have to stick to the subject. But anyway, for my point, I see this down the road as another mandate. Coming down the road, when you allow the federal government to mandate to a private citizen, you've gone beyond socialism and entered communism. And make no mistake about it, once they find out they can do this, they will mandate every right you ever had away from you. Thank you.
Do you see it as a mandate?
Nope, it's in the bill. It's not a mandate. This is anything but a communist plot, and the Politburo is not going to be telling people to buy it. You can make that decision yourself. What is more American than that, than the spirit of autonomy to make a decision for yourself?
Cooksville, Tennessee. Good morning to Cal on our Republican line.
Good morning. Thank you for taking my call. You know, I get a little tired of government trying to take over the entire insurance business. Now, I deal with long-term care all the time. But let me tell you something like that. People like that want to make the choice. Families sometimes here in the South especially do what they have to do to take care of their loved ones. They don't mind it. That's part of the Southern way of doing business. But you know, the same thing like that is I'm tired of it taking over the national health care business, trying to take over our long-term care. People have a right to choose not to do it or want to do it. And the money sometimes you guys would put in this kind of a plan is money that people can save for a long-term period, and they can really not buy something have a good plan by themselves. So it's a little bit more. My biggest concern is what's next. You guys are going to take over the auto insurance business and also the homeowners insurance. You know, this is just too much government. Government needs to get out of the way and let people do business. Thank you.
I think that's a recurring theme, and again, I come back to class is something you decide to do. It is economically based on the economics of large insurance pools. What he's talking about in terms of family responsibility, there's no question that families are responsible for their loved ones. We see it every day, and most families will have that opportunity, honor, and challenge.
Because this benefit is paid directly to the employee or the benefactor.
It's a cash benefit that you hear people talk ideologically about putting dollars back in control of consumers. This program does that. So if you are at home taking care of your mother and you have to work, and today you do not have somebody or someone that you can pay to come in and to help you with that while you work, this puts dollars in your hand to help you do that. Or if you're a younger disabled person who can work, if someone can help them get up, get bathed, dressed in the morning, and get to work, they can be taxpayers through a minimum amount of non-medical kind of support. So it builds on everything that our country stands for around values.
What's this going to mean for the hospice industry?
Well, the hospice is basically a medical home health care kind of need. But what it would do is supplement hospice with some things that might not be covered. Just like if you were part of a Medicaid home and community-based services program, this could get some things that government will never be able to cover. So it's a win-win for everybody. The good news for state budgets is the more people that sign up, the more savings there are on the Medicaid program. That's one of the good things for the taxpayer. The taxpayer wins two ways. They have cash in their pocket if they become disabled, and the Medicaid program begins to save money beginning the 6th year out.
Inlow, California, Democratic line. Beverly, go ahead.
I have a question, and the question is, if you're already retired, can you buy into this long-term care insurance?
I think the idea was that you had to be working, and if you're already retired and work part-time, I think there's allowance for part-time, but you'd want to work part-time to be able to participate in the program, as I understand the law.
Destin, Florida, this is Cy on our Independence line. Go ahead.
Yes, I was heard a fellow. He pretty much covered my question about the mandate. You got to have if you're going to have a mandate, you're going to have to regulate the insurance company real closely. If you don't believe that, just look what happened during Katrina. Now, I know our health care is not the same as homeowners, but if an insurance company can beat all those people that pay their premiums out of their money, they're going to beat the federal government out of the money.
Well, the good thing about class is the money is set aside into a independently overseen trust fund. I believe the president has the authority to appoint a group of trustees to oversee how the money is managed, and so in that sense, it has a lot of protections in it, and makes it much more transparent than, say, a private insurance product.
The Houston Chronicle, in writing about the program, wrote that to boost participation, the new benefit contains an opt-out provision, meaning employees of companies that offer it will be enrolled automatically unless they specifically ask to be removed. That may combat the historical lack of consumer enthusiasm for long-term care insurance. Some estimated that only about 8 million U.S. residents carry that coverage so far. So what is your best case scenario of the numbers under this federal plan?
I believe that the CBO studies showed a minimum participation, which is good because they took a conservative approach to solvency. According to Senator Dodd, there were 270 organizations, consumer, provider, advocacy organizations that supported class. It was unprecedented. And now it is incumbent upon all of us to educate the public about the need, because the more people that buy this, the lower the premiums will be, the more Medicaid savings will be, and more people will get helped by it. And I think you're going to find an enthusiastic nationwide group of people that will want to educate the public about the need to do this.
Does this create a new agency or department in the government?
Well, it obviously creates an oversight body for the money. The Secretary sets up an independent advisory council.
Health Secretary.
That's right, the HHS Secretary. And there would be a mechanism put in place which largely exists today to determine someone's level of disability. So there are tools and mechanisms to do that. And some have raised the issue of how do you protect people who are vulnerable, who have impairment of judgment or could be taken advantage of. And again, many of the resources are available to do that in every community. We hope we would be using existing resources as opposed to trying to duplicate things that already exist.
About 15 more minutes with Larry Minnix on long-term health insurance, long-term care under the new health insurance law. John in Anderson, South Carolina, good morning.
Good morning. My thing, I'm a conservative in a red state, but I've been supportive of the health care and everything because I think one of the things that our people miss, I think it's important to live a conservative lifestyle for me, but I think one of the things our people miss is what's happening in the long term as our population grows and we become more diverse in our population also and stuff. And we think about robbing from our children's future, but think about 10, 20, 30, 40 years from now, it's going to be even increasingly more important for us to have dealt with these, to deal with these issues and to move forward with them, and especially with things such as aging and all that. And I don't understand why I don't hear this presented more often as an appeasement argument, possibly toward conservatives. That's it.
Hey, John, you're raising a very good point. I feel the same way. I feel like it's my responsibility to plan for my future. And here's another mechanism to do it, because I don't want my kids to either start taking out of their own pockets to help me, and certainly I'd like to leave them something, if I can, without going on a government-imposed poverty program called Medicaid. So CLASS is the long view. It's one of the long view transformational constructs in the health care bill that I think gets lost oftentimes in a lot of the immediate political rhetoric.
David, next, Lynn Township, Michigan, on our Democrats line.
Yes, hi. So this new bill, excuse me, this new bill utilizes, any aspect of this new bill utilizes the insurance companies that are already in existence. Is that correct?
Well, the other parts of the bill, CLASS does not. It sets the money up in a trust overseen by a government appointed body. So it's not a private insurance plan, no.
Okay.
Yeah.
But the rest of the health bill, other than what you're just talking about, utilizes the existing insurance companies, correct?
And Medicare and Medicaid, the existing plans out there, it enhances those as opposed to dilutes them or tries to compete with them. There's plenty of competition, I believe, in the marketplace.
Okay. Because I've heard that this is basically funneling people into insurance companies that are already there. So I'm wondering where this idea that it's socialism or even communism comes from. In fact, the person who called this communism, they need to go and at least look up the word, before they start saying that, because there's no way you can say anything there is communist.
All right, David. Any last thoughts on that?
Well, again, I come back to CLASS is one of these plans that affects potentially most American families. From a red state standpoint, encourages self-planning, self-responsibility, putting money in the hands of consumers. From a blue state standpoint, is there for everybody. It's fair, it's just, regardless of your means, you get this daily cash benefit. We think we've got something that's a win for everybody that has no particular political boundaries associated with it. Aging and disability are equal opportunity contributors to problems in life. And here's a mechanism to help mitigate against those and help families fulfill their responsibility. Most families want to do this work. It's noble work, but it's difficult day in, day out, and here's a way to help them with that.
In looking at healthcare costs and where the money's going over the weekend, the New York Times, they wrote about this long-term plan that others note that the revenue from a new long-term care insurance premiums counts in the coming decade, but that the long-term care program will have to pay out benefits in the decades after that.
Right. It's a 5-year ramp up and then a 5-year vesting after that.
So nobody can take advantage of it for 5 years. You start
Right.
paying in, you...
And what a concept. You actually prepay for benefits. And then the CBO score said that the plan is solvent for 75 years based on conservative assumptions. And then the Secretary has to report periodically if it looks like it is going to be in a deficit position, then she has the authority to adjust the premium. So it's a good thing. In the 10-year budget cycle, yes, it's revenue without expense. In the second 20 years, the whole thing, the well never runs dry because you, in effect, are pre-funding it through premiums.
Our guest, Larry Minnix, has undergraduate and graduate degrees from Emory University in Atlanta. What's the graduate degree in?
I have a doctor of ministry. I'm actually a clergy by profession. You'd think that in some ways I'm already in the insurance business.
Here's St. Clair Shore in Michigan, and Harrison, good morning. Go ahead.
Morning.
Good morning.
First of all, thanks for C-SPAN. I have a very practical question specific to my situation. I'm 82 years old. I've had several different health problems such as heart attack, cancer, seizures. Actually, right now I'm fairly healthy. But I want to know what's going to happen if I suddenly become disabled and have to go into a nursing home for full-time care. Where are my benefits coming from, if I have any? I'm sure there might be some with Medicare. How do I pick up the slack if there isn't anything to supplement that?
Well, you're expressing the major problem that the country faces. Did you say you're 80 years old?
He's gone now, but I thought that's what I heard too.
80. Well, see, what you have right now is if you come out of the hospital, say with a broken hip or a stroke, the chances are good that you'll get several weeks of Medicare post-hospital coverage. And if you have to go to a nursing home after that, then you would either have to pay out of your own pocket, or if you have private long-term care insurance, it may help you, or you'd go on Medicaid. And those are very difficult choices to make. And the issue is, like many Americans, you don't know what you're qualified for today because these things are very difficult to talk about. So if you were working today and you were 70 and you joined this plan, the chances are pretty good that you would have a daily cash benefit in order to help you stay at home, or at least stay in a situation of your choice until you and your family could make long-term decisions for you.
We'll hear from Spring Hill, Florida next. Samuel, good morning on our Republican line.
Good morning, and welcome to C-SPAN, and keep up the good work. My question is this. For over 10 years, my wife and myself have had health care for disability coverage. What happens to the existing plans that are out there now? The new regulations would be the reduction in premium state by state, or is this going to be a program totally responsible through the federal government?
No, here's the way it would work. If you have disability insurance today for income replacement, you would keep that. I would certainly keep mine. I have private long-term care insurance. My wife was denied coverage because of pre-existing conditions. So she is self-employed, and I would begin buying this for her and for me. I would see for me as a way to supplement what the private policy would provide, and for her it would be the primary coverage. So it's designed to complement in the marketplace what is not available to most Americans today. And nobody really wants to self-impoverish themselves on Medicaid, which is what our only alternative is long-term.
And for this federal plan, does it also have no pre-existing conditions? Is that
correct? That's one of the beauties about it, is no pre-existing conditions. And some critics said, well, you can't make it work that way. You got to have people in there. But if the pool is large enough, which we think it will, what a concept. You actually have insurance for people that may need it. I mean, that's what insurance is for. So I've become friends in this process with a 40-year-old woman with cerebral palsy who works as an attorney here in town, has a teenage son and a husband. She can't get private long-term care insurance, but she anticipates working for a long time, but she'd like to start paying in if she gets to the point that getting to work is difficult, but she wants to continue to work. She would have a daily cash benefit to help her continue to be a taxpayer. Again, what a great concept.
A few more calls for you. Dixon, Tennessee. Raymond, Independent Line. Hi there.
Yes, thank you, C-SPAN, for taking my call. I have a question in regard to this health plan for long-term care. In reference to their medications on this with the Part D, they offer these 90-day plans, but I don't know if the speaker is aware that with these 90-day plans, if you're in assisted living or a nursing home facility as required by the state governing of these organizations, their drugs are required to be blister packed. So people in these facilities can't take advantage of the 90-day supplies because none of the organizations that provide the 90-day drugs do blister packaging, so you have to settle for mom and pop prescriptions. So this costs the individual more in the long run for medications, and I found that true with Tennessee, Alabama, and Georgia. I have a mother that's in an assisted living.
Thanks, Raymond. Anything can be done about that, or?
Yeah, what you're speaking to is some of the bureaucracy and waste associated with a lot of care delivery concepts and institutions, and the whole issue of how is the most economical and safe way to deliver medications is being studied in other arenas. If class were in place, the day you walked into that assisted living facility, you would walk in with $50, $75, maybe $100 a day to help you pay for assisted living, which right now is either coming out of your pocket, or if you're in a state that permits Medicaid payment for assisted living, and most don't, you would not be eligible for assisted living. So, so the good thing about class is you've got money as a consumer to help you take that first step to get care that you need, where you need it, in a place that you call home.
To Memphis next, and Evelyn on our Democrats line. Go ahead.
Yes. Thanks for taking my call. One thing, William, it just makes me so happy that now America is really paying attention to what's going on, because I worked my job for over 19 years, and I'm on long-term disability now. And to me, as a citizen, you know, of course, we all say that we don't want government to run our life, but it's the job. But when the government officials say that, that's giving them leg room not to do their job and make our country become a welfare state. Now, once I got on long-term disability, once I got sick, you know, I was forced to get my son out of college and come back home to take care of me. You know, I'm a person that believes in insurance, health insurance, or whatever I need to do to protect myself. Through my job, I have a long-term disability insurance, and I got the supplemental insurance. Now, once I got that, you know, it seemed like they were doing things to keep me from getting my benefits. And once I was eligible for my benefits, they told me that I had to go on Social Security.
And Evelyn, who was your long-term, your supplemental through?
Through Comcast. I was a sales representative. I sold and installed cable service, and your show is one of the shows that I really promoted, because people need to be aware, especially young people, that how important you are. to America so they can understand the way things work, you know. But, you know, if the thing is, if I had this insurance, I wouldn't have to take my son out of school. I would have had somebody to try to help me out at home. And then I fell behind on my bills and everything. And now I'm on long-term disability.
All right, we'll get an answer here from Larry Minnix.
She's talking about the very problem that class is set up to resolve. She became disabled, and she's pulling her son out of school. She's having to kind of do it as catch can. She's become more and more poor in doing so. And had she had this plan, and Comcast would have made it available, not at Comcast's expense, but at her expense, she would have cash in hand to help her supplement her daily needs. And think about what impact that has on her son and other members of her family that are probably doing a lot of things to help her make it that make it difficult on the whole family.
Larry Minnix is the president and CEO of the American Association of Homes and Services for the Aging. The website is AAHSA.org. What will folks see when they go to that website?
They can go to that website. We'll give them a health care update. If you look at the section on class or long-term care financing reform, we have some things there. There's a website that we've developed with a number of other groups called Seniors to Seniors that has some other good information on it that we, AARP, and a number of other groups have done. So there's plenty of information out there, and it's time for families to start planning. These are hard things to talk about, and any of our lives can change in a heartbeat, a traffic accident, an accident on the playground, where suddenly you thought you were invincible and everything's all right, and suddenly you are living a life of family with coping with long-term disability. And the good news is there are solutions to these problems, and we think class is a huge step in that direction.
Well, Larry Minnix, thank you for coming on and explaining that part of the law to us.
Hey, if you get old, call me.
That'll about do it. Thank you for joining us this morning here on Washington Journal. We will be back as usual tomorrow morning, 7 a.m. Eastern. We'll see you then.